Hi, I'm Dr. Kat from Elegant Implants. Welcome back. Today's big question is, what is dental insurance and do I even need it? Before we talk about whether or not you need dental insurance, let's first discuss some of the terms and ideas you might see while researching insurance in the first place. To begin, when we refer to dental insurance, we're talking about what network you belong to, and network simply means which dentists you can see, which offices you can visit that's covered by your network. So usually you'll see two major groups. First, HMO or DMO, which stands for Health Maintenance Organization or Dental Maintenance Organization. That's usually one group. And then on the other hand, you'll see PPO, which is Preferred Providers Organization. So we'll talk about both of those. So within HMO or DMO, generally it's a smaller network. You get a smaller list of doctors or dentists to choose from. Once you select your doctor or dentist, that person, that's the only person that your plan covers. If you are really not ever traveling, if you're only near your home or your work, which is close to where your doctor or dentist is, if you only ever require preventative care, you're perfectly healthy, you have nothing wrong in the mouth, you'll never require a specialist or need a referral, then that's fine. But as soon as you are away from home and need to see a different doctor than the one you originally selected, if you require any sort of specialty care, so you do need that referral, now you're outside of your plan and you're paying different fee schedules, you're paying out of pocket. The one exception to that is if you are traveling, seeing friends and family away, there's some sort of emergency, your HMO may cover whatever emergency fund there as a one-time thing, but that's completely discretionary. There's no guarantee that'll happen. Now we're talking about PPOs, which stands for Preferred Provider Organization. With PPOs, you have a larger network, and maybe most importantly, you just have a lot more flexibility and freedom. So instead of being locked into one home office, one home doctor, one home dentist, as with an HMO, DMO, here you really can see any dentist, any doctor, which is really nice if you're traveling or have some sort of emergency away from home. With an HMO DMO, you will be paying less in co-payments, and if all you need is preventative services, you're all set. But as soon as you need anything beyond those basic services, you need to wait for insurance authorization, you need to get a referral. Basically, you have to hold on. With PPOs, you will be paying more in co-payments, but there again is a broader range of services available and a broader range of providers, so you can see who you need to without having to wait. Here in Washington State, we have Delta Dental Premier. It's different from HMO DMOs, it's different from PPOs. Basically, it's designed for specialists. So as a result, you get the greatest range of services built into the plan. Here at Elegant Implants, we are Delta Dental Premier providers. While many employers will offer HMO DMOs or PPOs, many employers don't offer Delta Dental Premier because it's the most expensive for the employer. However, our advice is if it is offered, you should take that plan simply because it was meant for specialists, and as a result, you get the greatest variety of services as well as the most flexibility built into the plan. So now we move to the fourth option, which is really a separate issue because fee-for-service is like the non-insurance. So because your doctor dentist isn't contracted with any company, you as the patient don't need to worry about copay, deductible, maximums. You don't have to worry about waiting for approval from the insurance. Really, it's the sky's the limit as far as you and what you and your doctor or dentist decide that you need. At Elegant now, we are premier providers for Delta Dental, but before we were premier providers, we were actually just a fee-for-service group because we're a group of specialists. So now we do both. There's no limitations or contractual restrictions on how we bundle different services or based off of your individual needs. So to clarify, some of the terms I've been using today may not apply to you if you're in a different state. So I think HMO, PPO, and fee-for-service are pretty generic across the board. But DMO, Dental Management Organization, might not be something that's used in your state. The program that we have, Delta Dental Premier, may not be available in your state. It might be called something else. So just to clarify. To kind of summarize all of it, in one big group we have HMO, DMO, PPO as kind of one way of doing things, and then over here, which is where Elegant Implants operates, there's the program Delta Dental Premier and Fee for Service. So really, I mean, it depends on you personally. If you're young, you're healthy, you really can only foresee preventative services being necessary, checkups, cleanings. You are relatively stationary, you're not traveling a whole lot. Getting into a program like an HMO might be great for you. However, if you are older, your health is questionable, you have a lot of complicated issues with your teeth, or you travel a lot, a PPO might be more appropriate for you. Obviously, if it's an option, we would always recommend getting into a program more like Delta Dental Premier, just because you have the greater variety of services available as part of your program, more flexibility. And obviously, ultimately, fee-for-service allows you the most flexibility because you're not beholden, your provider isn't beholden to any given program. So really, you can make choices based off of what you specifically need in any combination of service packages or bundles that are necessary. Well, here at Elegant, coming from a pedigree of multiple generations of dentists and specialists, what we feel is that insurance doesn't necessarily equate to care. Coverage doesn't necessarily equate to care. Really, with all of these insurance types that we've been talking about, what you're paying for is the network. So before you spend any money on a new insurance plan, please make sure you understand what your network is, what the coverage is. If you have questions about any of that, please give us a call here at Elegant Implants. We would love to explain to you with any given plan what you're paying for versus what you receive, and to give any sort of comparative quote for any services that you might need.